Hey guys, it's Allie, and this week's topic is actually plastic surgery. Um, Before I get into that, I actually want to talk about something really, really important. Um, it might not be important to you, but it's important to me, and I think I should share with the world. Um, I got my nose piercing again. Yay! I'm so excited. And I got new hoops, which I'm excited about. Yeah, but let's get to the topic. Plastic surgery. I totally agree with it. I feel that no matter who you are as a transgendered individual, you feel the need to have plastic surgery, no matter who you are. Um, as transgendered females, we are insecure with some parts of our body. It really doesn't matter who we are, but we always have a certain thing, like, let's say, my jaw. This is something I wanted to take care of. But some girls don't have this problem, but I do. Just like my lips. I have really feminine lips. Some girls don't. You got it? Well, anyways, so they want to get that done. But anyways, the reason I agree with plastic surgery is because there is no shame in trying to be beautiful. If you have the money and you're not scared of going under the knife, why not? It's your life. Life is too short and no one's living your life. You're living your life. And just like you buy clothes, just like you buy accessories, why not buy a pair of boobs? There's no harm. You're not hurting anyone by doing so. And if they feel like hurt or something, whatever, then that's their problem, not yours. But anyways, I don't totally agree with plastic surgery. I feel that there is a negative part of plastic surgery that I do believe people should be aware of. And there's nothing wrong with plastic surgery as long as you know your limit. Um, I've always known that you have to find other alternatives before you actually do go under the knife. Um, but yeah, let me give you an example of an alternative. Um, I want to get my jaw done, and this is something I wanted to talk about. But I feel that having a jaw reduction is a really hard surgery. It's one of the most painful surgeries out there, and I don't feel the need to go under so much pain. So there is another alternative, and it's Botox under the muscle. So it'll actually make it look softer. And as you can see, my jawline is not defined. It's not like a guy's jaw, but it's prominent. So I just don't want it there. And instead of just taking it all off, why not just make it smaller? So that's an alternative. Um, when it comes to other surgeries I want to get, um, you already know I want to get these. I feel every girl wants to get these. This is like the main thing that a transgender girl wants. Boobies are the first thing you should get. But I don't feel that that's the first thing I want to get. I don't feel that my boobies are going to be the only thing that I'm going to be stressing about. As you can see, hormones are doing its job, so I don't have to worry about anything. Um, Getting a boob job at this point is just my preference if I decide to get it. But at this point, I don't need them, and I probably do need them, but I'm a dancer. I'm comfortable with my body. I love my tits. They're right there. And I don't have to be like, "Ugh, I have big boobies." I don't want to be like that. If I do get saline, which is the one that I want to get, I don't deal with silicone. I wouldn't dare. But I want to get saline. So what I want to do is, if I'm a B or a C at the end of hormones, which I'm gonna be a C, but if I'm a big B, I probably get like a B cup as a implant. I know some of you guys might be saying like why, but they actually do make a difference. And once the implant settles, it's gonna be small. It's gonna be your size, but they're gonna be rounder, perkier, and they're gonna be like there. So instead of having like a B like this, you'll probably have like a B like this, which is what I want. I don't want big tatas. I don't feel the need to have big tatas. I feel that for my shoulders, I should have big tatas because I do have broad shoulders, but I don't feel I need them. You tell me. But the most important surgery that I want to get, and I feel that is the most important surgery on my list, is my tummy tuck. Um, some of you guys might be thinking why, and the reason is if you actually have seen my videos, you'll know that I used to be fat. I used to be 230 pounds, and I lost 100 pounds, which I'm excited about, but I gained 20. But it doesn't matter. I don't give a shit. That's all booby weight, so who cares? Well, not all of it, but Bella, come on now. Um, but yeah, what else? What else I want to get? Um, my guilty pleasure would be like my lips. I want to get my lips done for some reason. I don't know why. I just want like my upper lip to be like I don't know why. I love my lips, so I don't think I'm gonna get that done. That's just something in my mind. And if I have the money, why not? It's just like what 6 months, and once after that, they're normal. So I'll think about it. And what else? So it's yeah, that's it. I don't feel I have to do anything to like my lower region when it comes to like my ass and my hips. They're my hips aren't like like I'm not a big girl like oh look at me, but I do have a good amount of ass, so I'm proud of that. And I don't feel like I'm gonna mess with anything down there. I look at girls and I'm like, what the fuck did you do to yourself? Like seriously. Some girls have like a ball and then they have like fucking toothpicks for like legs. It's not attractive whatsoever. My boyfriend doesn't think it's attractive. And I've asked plenty of dudes, they don't think it's attractive either. Um, I feel that as long as I'm on hormones, my hips are gonna get bigger and my ass is gonna get bigger and I'm only gonna get fatter. So, and I feel like I've been on hormones for 8 months and my ass is like jiggly. It's too jiggly. And I've seen an immense difference for like my thighs are like they used to be rock hard and now they're not. They're not rock hard at all. So, yeah, and my arms like it's all like squishy and shit. Um, but yeah. Um, as I said, there's a limit for plastic surgery, and I'm not saying that all girls do need it, but I'm saying that if you feel like you need it or you just want it, don't let anyone stop you. Just make your research. That's all I tell the girls that I talk to. Do your research, no matter what it is, hormones, plastic surgery, the guys you want to date, it doesn't matter. Do your fucking research. Do your research because no one's gonna be on your ass telling you do this, do that, do this, do that. You have to do it by yourself. And no one's gonna be there for when you are sad or when you're depressed. No one's gonna be there for you. You're gonna be by yourself. So you need to think about that. Keep it in mind. Do things for yourself. Don't give a shit what anyone has to say. I forgot about it. I'm always gonna keep it real with you guys. Like I like that most of the girls give you like both sides. Whatever comes out of my mouth comes out of my mouth. That's it. Um yeah. My advice is just don't go overboard. That's it. See me? Something on my face? My breast, of course, because that's something we need, and a little bit something else, and that's my tummy tuck. These are normal procedures that girls have. And if you see a regular girl doing this, you'll be like, yeah, you need to stop right there, sweetie. 3 surgeries, that's fine. Stay there. And that's where I'm staying. And that's where you should stay too. But yeah, that's my video. Love you guys. See you next Friday.